it's okay. I'm so sorry. I was trying. Oh no, it's okay.
I'll start like halfway through.
Okay.
Ready?
Yeah.
Okay. Leon established several relationships with community organizations and developed off-campus rotation sites for the students to gain real-world experience. Leon then transitioned from academia in 2019 and began working for DentaQuest as the Tennessee Outreach Coordinator. Once again, Leon engaged community partners and key stakeholders to help increase the utilization of dental benefits to Tennessee's Medicaid population. Leon is excited to use his knowledge and experience in his new role as Dental Support Center Director for USET. As DSC Director, Leon's vision is to provide support to the USET member tribal nations by assisting them to address identified dental needs for their tribal citizens. Mr. Roberts' goal is to visit all USET member tribal nations and collaborate with them to develop strategies to increase access to oral health care, whether they have a dental clinic or only offer PRC. Please welcome Leon.
Hello, everyone. Thank you for the introduction, Amani. Let me see if I can get this here off real quick. How do I pull the slides back? Oh, and hi, everyone virtually. And everyone in the room. Oh, thank you. Okay, so thank you for the introduction. I'm Leon Roberts II, and I will be going over the 2022 GPRA dental measures for the Nashville area. These slides were prepared for me by the area dental officer, who is Joseph Park. Next slide. Oh, wait, oh, no, yeah, you say that.
No, I got you.
I got it. So, thanks for the introduction once again. A quick bio. Amani hit all the high points for the most part, but I am the USET Dental Support Center Director. I started here at USET in December of 2021. So last year, I am a dental hygienist by profession. I'm an educator, like Amani had stated, graduated from Tennessee State University, also went back and taught at Tennessee State University, did some outreach in the community surrounding the Tennessee State area for experience for the students and to get patients, to recruit patients to the clinic. As an outreach coordinator for DentaQuest, I traveled the state of Tennessee, and I was going to rural areas trying to increase access to care, to dental care for our TennCare members. So DentaQuest basically managed the dental part of TennCare for Tennesseans. And so my job was just to go out and outreach and try to increase utilization of services. And so while I do not have experience prior to this position at USET, I do not have prior experience in Indian country, but I have worked in rural areas. And the disparities that I see in the rural areas were not just what I've seen in Tennessee, I've seen them throughout the country. And so I'm excited to come into this position and work in Indian country because I think first off, there's a need. And like Amani had stated earlier, like my goal is to help provide support for the USET member nations primarily because USET, this is the organization that we work for. And so I'm gonna primarily focus on those USET tribal members first. But I would like to offer support throughout the Nashville area, whether they are a USET tribal member or not. But primarily, my job right now is initially to work with those USET tribal member nations and whether they have a dental clinic or not. So later on, I'm going to show you, I'm going to go over the GPRA information, but I'm going to show you how we can also increase access to care throughout Indian country with portable dental equipment. Next slide. So what is GPRA? GPRA is Government Performance and Results Act. So the Government Performance and Results Act of 1993, it is a public law that was passed by Congress in that year. And if anybody knows about working with Congress, it takes a lot of stuff to go through Congress. So it was a great deal to get this act passed. And GPRA was enacted to improve stewardship in the federal government, to link resources and management decisions with program performance. So that's why one of my goals is outreach here in this position, asking for or working with those tribal nations who identified an issue, and then I can help them improve that. If you haven't identified any issues, I can help with some strategic planning on how to address certain issues once we identify them together. I do not want to go in and just point out what issues are, because tribal nations have been here for a while, a long time, and some of them have already identified some issues. So I can help with that. I can help with planning, but I have to be asked for that. I just don't want to initially go in and make it seem like I know what I'm doing, know what I'm talking about, because you all have a better sense because you're there. Okay, next slide. So there are some requirements for GPRA. So it requires that all federal departments do the following: develop a strategic plan specifying what they will accomplish over a 3 to 5 year period. We have to set performance targets related to their strategic plan on an annual basis, and report annually the degree to which the targets set in the previous year were met. Then we also must conduct regular evaluations of the programs and use the results to explain their successes and failures on the basis of the performance monitoring data. So I am working with the area dental officer, and we are trying to come up with plans with those tribal nations who are having issues. What we're about to show you in these next slides is when it comes to GPRA measures, the Nashville area is doing well compared to the national average. So we're doing a lot of things right in the Nashville area, but things can always be better. Next slide. Ooh, okay. I was not expecting that. So nice little effects there. Access to dental care. Is there a way we can move this picture just a little? Perfect, perfect. Oh, just a little bit. So up here so I can see. Yeah, I like to see right there, so I can see what the people out there in the virtual world are seeing. So we all see the same thing. So, access to dental care is closely aligned with Healthy People 2020 as a percentage of patients who have visited the dentist within the previous 12 months. So every 10 years, there'll be a Healthy People. So the next one will be Healthy People 2030. This helps us come up with different kind of guides, what we need to do. You know, also access to preventative dental services, fluoride, varnish, and sealants is critical to control oral disease. Later on, I will talk to you a little bit more about sealants, what they are, how they're used, and how they can prevent oral diseases. So for the GPRA data, they're looking at the proportion of 2 to 15-year-olds receiving sealants and the proportion of 1 to 15-year-olds receiving topical fluoride. Now you may ask, why does one go from 2 to 15 and the other 1 to 15? And I'm here to tell you, I don't know why that is. Don't know why that is. And one of the other things that's surprising to me is it says 2 to 15-year-olds receiving sealants, because generally speaking, as a dental hygienist, I place sealants. You really only want to place sealants on the permanent teeth. Children's permanent teeth do not begin to erupt until the age of 6. So that's generally when we'll start placing sealants, and it'll be on their permanent molars. So I'm not going to give everybody a dental lesson today, but the first molars are the first permanent teeth that erupts in a child's mouth, and they come at 6 years of age. At 12 years of age, generally speaking, that's when their second molars erupt, and we also call them 12-year molars. So mostly, if we can catch a child at 6 and 12 and place sealants, then we can protect those teeth from forming cavities and other dental diseases. Okay, topical fluoride is a little bit different. After you get a cleaning, you want to put some fluoride on the teeth just to strengthen them. That is the purpose of the fluoride. So what GPRA measures is 3 things. GPRA measures a lot of different things. It's not just dental, but as far as the dental measures, it is really just accessing 3 things. It's fluoride utilization, sealant utilization, and access to care. Those are the 3 things that GPRA dental measures are in place for. Next slide. Oh, wait, sorry. Going to this last piece real quick, y'all. See y'all out there. Topical fluoride varnish and dental sealants have been extensively researched and documented in the dental literature as safe and effective preventative interventions to reduce tooth decay. So today I am in front of you as a dental hygienist. As a dental hygienist, I'm all about prevention. Okay, my job as a dental hygienist is to help prevent diseases from happening. The dentist, their job is to restore the tooth once something has already happened, some damage has happened. So we want to stop it from happening as a dental hygienist. But if someone isn't going to the dentist regularly, if they're not being treated and then they end up having cavities or tooth decay, then that tooth has to be restored. So we want to stop you from having to go to the dentist to get your teeth restored. And sealants and varnish and going to the dentist regularly, those will stop those things. Next slide. So the probability of improving the dental health of the community depends on our ability to increase the capacity of providing preventative level dental care. Okay, so if we can stop it on the front end, we won't have issues going on in the back end, because the long-term results will significantly decrease demand for higher levels of costly dental care, such as crowns, bridges, root canals, implants, and even dentures. Okay, so we want to really start pushing preventative dental services. So one of the things, I've had several conversations with Dr. Park about sealants and fluoride and how we can increase the utilization in the Nashville area. So like I said earlier, I'm gonna talk to you about portable dental equipment. Later, you're gonna see some slides about what they have done at Dr. Park's dental clinic, which is St. Regis Mohawk. Next slide. Ooh. So Dr. Park did all this stuff. When I was preparing, I didn't see any of that stuff. So this is news to me. So 2022, we're going to jump right into the GPRA results. So this is as of June 8th of this year. As I told you, the Nashville area is above, in many cases, when it comes to fluoride, way above the national average. Access to care, we're above, and sealants slightly above. And this is the 2022 data. Okay, next slide. And the next slide you're gonna see is the 2021 data. Okay, so in a sense, I kind of would like to have them side by side, but it's okay that we don't. But you can see though, there's a lot more, there's more use, it looks like, in 2021 than in 2022, but some of that is because the data for 2022 isn't complete. So that data is just for half of the year. Okay, so it looks like a difference, but it'll probably catch up by the end of this year. But once again, just like in the previous slide, what you'll notice is when it comes to access to care, when it comes to sealants and topical fluoride, you'll see the colors are closely related though, but the light blue, the Tennessee Titan blue. If anybody out there knows, I don't know, we got the football fans out there. But the Tennessee Titan blue, that one is the national average, and I'll just say the other color is Nashville. Okay, so you'll see the Nashville, we're going way above, and I would love to continue this trend. And like I said, in later slides, I'm going to show you how we can do that. Next slide, please. So the next thing, who was like magic, y'all? 2020 results. So I think we just showed the 2020 results. Did we just show those? Say 20. Well, no, we showed 2020. Yeah. 2020, it started 2022, 2021. So yeah, sorry, Dad, Monty, you're doing a great job. Keep up the good work. So once again, you'll see now, when it came to sealants in 2020, one of the things that I do want to point out with the 2020 data is, as everybody may remember, we're still going through a pandemic, but it really started in 2020 when everything was shut down. In the state of Tennessee, it was March of 2020 when our Board of Dentistry actually shut down any kind of dental treatment except for emergencies. It was emergency only, and it was about a month in the state of Tennessee. It varied from state to state. I don't know, I'm interested to find out how much it varied from tribal nation to tribal nation. But things, some places are still relatively shut down, but most places are open back up. One thing I can say about 2020, by the end of that year, dental practices in general did not go back to pre-COVID numbers, but it did start getting more stable. And the 2021 numbers got better, and it's looking a lot better in 2022. So just a caveat to this information, like I said, 2020, the numbers are going to be a little bit different because COVID changed everything. Next slide. And the numbers for 2019 to 2020 still somewhat similar though. So this is just for the Nashville area. But like I said, one thing that I really want you to get from these slides is the fact that the Nashville area is above the national average on all of the GPRA measures. And this is something that we want to continue. And it's not only something that we want to continue in the Nashville area, I would also like to look at numbers at all of the regions across Indian country. And if there is any region that is below the national average, then maybe there's some things that we can collaborate with them to help increase those numbers. Next slide. Ooh, that was a whole lot. Okay, so we are here at the USET 2022 Best Practices Conference, and I have 3 best practices for you. Here we go. So the first one is collaboration with local schools to provide dental services. So in the next couple of slides, I'm going to show you what they've done in St. Regis region. I've also had several conversations with other tribal nations where they have a SEALIT program where they use portable dental equipment and they go to a school and they're able to provide dental care. They're able to place sealants. The only thing is with sealants, as a dental hygienist, I was trained is great to have x-rays. I don't know whether they are using x-rays at some of these locations where they're having these providing dental services. I don't know if they're taking x-rays because x-rays are very critical in the dental profession because we can't see up underneath the gums and a lot of things are happening beneath the gums. Okay, so it's hard for us to do our job if we don't have all of the assessment data. So x-rays is part of that. So I will show you, we have USET has purchased some x-ray equipment that we can use as portable to help aid in that. So going to local schools, collaborating with local schools, that's the first thing. Second, provide screenings and fluoride varnish at health fairs. So one of the things that I'm currently doing is I'm going to be traveling to the Wampanoag tribe of Gayhead Aquina in September. They have a powwow the second weekend in September. And USET has already purchased some portable dental equipment. And I'm going to be taking that equipment with me to that powwow. At this particular moment, I do not plan on using that equipment for treatment, just kind of showcasing it, because we're going to be doing some other things. But in the future, that is what I would like to do with our portable equipment. And that is something that others can do too. USET can help you procure portable equipment so that you can use it at your tribal nation. And we'll get into that a little bit later. But that's one of the things, providing those screenings at health fairs or powwows. The third thing is collaborating with other departments such as medical and WIC. One of the other departments that we are kind of collaborating with is diabetes. Dental and diabetes is a correlation that has been known for several decades. Okay, so we're trying to collaborate right now to see what can we do for those diabetic patients to bring dental, because I've worked with our diabetes officer at USET. And one thing that I found is during the pandemic, diabetic patients, they still went to the ophthalmologist and they still went to their physician, but the dentist they did not go to for various different reasons. But whatever those reasons are, we're here to resolve that, okay? And my job as the Dental Support Center director is to help you increase the health of your tribal citizens. Okay, so it's not just about treating the mouth, it's about treating the whole body. We have to look at this holistically. Okay, the mouth is the gateway to the body, so we have to start there. Next slide. So here's some examples of some project the St. Regis Mohawk Tribe. The objectives are to increase the number of 0 to 3 year old children with at least one fluoride varnish application by 20% and increase access to care by 10% compared to the previous year. Okay, that was their objective. This is how they accomplished that objective. Okay, they accomplished it by on-site visits of tribal early Head Start program and 3 tribally supported private daycare centers. They screened and applied fluoride varnish to 61 of 78 enrolled children. So I'm not a mathematician, but those are pretty good numbers. That's over 75%. So over 75% of the enrolled children actually were screened and had fluoride applied. The result of the project showed a 3-fold increase of 70% in fluoride varnish applications and a 2-fold increase of 23% in access, in dental access for 0 to 3 year old children. Okay, seeking these hard to reach young children that would otherwise not have seen, not have been seen, took less than 2 hours. Took less than 2 hours to see those 61 children, and that's good. You know, so this is an example of what they're doing at St. Regis Mohawk Tribe that can be duplicated. Next slide. Now, what they did was, how they were able to accomplish this, in 2012, they were awarded $25,000 to start a school-based sealant program. Can anyone guess who provided those funds of $25,000? Anyone in the room?
USET.
USET! Yes, USET. We provided. So, you know, since you kind of gave an answer, we have a gift for you. This is an electric toothbrush. Thank you for participating.
Oh, well, fun.
No problem. And there may be another question later on at the end of the presentation so that you virtually can also receive a gift if you answer correctly. So, we provided them $25,000 to start a school-based sealant program. Okay, so they screenings were performed before and 2 years after the program began. It resulted in an astounding 50% reduction in childhood carers. So the staff dentist and myself, this is Dr. Park talking. The staff dentist and myself working around the clock, 24/7, would never be able to reduce childhood killings by 50%. That is a direct quote from our ADO, Dr. Park. So you see, they're doing good things. Next slide. So here's some of the evidence-based facts, okay, from the CDC. So untreated cavities can cause pain, infection, problems eating, speaking, and learning. So states can help millions more children prevent cavities by starting or expanding programs that offer dental sealants in schools. Okay, so cavities, when it says it prevents learning, there are a lot of school hours that are missed because of dental pain. If those children had sealants placed on their first and second molars, then maybe they would not have that pain, okay? Also, when it comes to, besides just children, because this is talking about an example of what they did with pediatric or children, but we can also use this in nursing homes with geriatric patients as well. Okay, so when it says problems eating, geriatric patients may have to take medication and may have to have food with that. If you cannot eat or if you cannot chew properly, you may have a problem taking medication, so it's more than just the mouth, okay? So sealants are a quick, easy, and painless way to prevent most of the cavities children get in the permanent back teeth where 9 in 10 cavities occur. So most of your cavities are gonna be in your back teeth, past the smile line. But those are the teeth that you use to chew and grind up food. So if you have a sensitivity to cold, which a cavity can cause, try to eat some ice cream on a cavity. Not a good time, folks. Okay, so we can get that, we can resolve that before it even becomes a problem. All right, so the sealants are the best, quick, easy way. So once applied, sealants protect against 80% of cavities. So yeah, there's that other 20%, and sometimes sealants do fail, but they can be reapplied as well. Okay, so it's really important to protect them. It's all about prevention. You want to prevent something from happening. One of the analogies I used to use in the clinic when I was treating patients is going to the dentist is like getting your oil changed in your car. You go to get your oil changed every 3,000 miles or 3 months, not because there's something wrong, but to prevent something from going wrong. And also it gives the mechanic a chance to look under the hood to see if there's any other problems going on and they can catch them early. But if you don't go get your oil changed every 3 months or 3,000 miles, and then that light, that oil light comes on, that dreaded oil light, at that point, you're gonna need more than just an oil change. You may actually need a new engine. And how it relates to oil carriers, you may need all new teeth if you don't go to the dentist regularly. Okay, so that's why it's important to go to the dentist to prevent something from happening. Now, once something has already happened, then it has to be restored. So like I said, that's my job as a hygienist. I'm always about prevention, y'all. So we want to stop that from happening. So sealants can eliminate the need for expensive and invasive treatments like dental fillings or crowns or the dreaded root canal. Want to avoid that, folks. So next slide, please. So school-based sealant programs are effective but underused. So dental sealants can prevent cavities when applied to molar teeth. Molar teeth are your back teeth. So one of the things, people, you can't see me pointing at the slides on the video. Can they see me? I'm sorry, but what you'll see on the slide is you have a tooth without a sealant. So no tooth, no sealant, no decay either. So this is just what we call a virgin tooth. There's no issues with that tooth. So say in this child, that tooth just erupted. You're gonna apply the sealant. With the sealant, what I like to say about the sealant is, it's a filling without the drilling. Okay, so I'm not drilling down, making a hole, and then packing it. What I'm doing is I am just painting a material, what we call these fissures in the tooth. So it's just filling up that space, and it's gonna protect it from allowing cavities to form there. And then boom, what you see shining like diamonds right there, woo, that is the tooth with a final sealant. So school-based programs are one way to reach millions of children with sealants to prevent cavities. Next slide. Oh, dang, it's dropping on us. So this one is, so you saw like an animated tooth. This is actually a real tooth. So one of the things that we have to do before we paint the tooth, we have to put an etchant material to kind of roughen up the surface. So that's why if you look at this natural tooth, it looks a little rough because they have to put some kind of an etchant material first. Then you spray water and spray it clean and dry it off. Then you just paint, it's a filling without the drilling. You just paint that material on, then there's a light, you just zap that light for a few seconds, and then boom, you have a before, and then you have an after. Okay, and it is glistening. You see the shine off of the sealant right there. Next slide, please. So another thing is, I'm not going to go too deep, but it's called EFTA or expanded function dental assistance. So it's also something that they've also done in St. Regis. And here's some project conclusions. So in the American Indian, Alaska Native communities, they suffer disproportionately compared to other Americans with regard to oral health disparities. And a lot of that, what I've seen thus far, is because a lot of the American Indian Native Alaskans are, for the most part, what I've seen in rural areas, very remote areas. Some of them may have a dental clinic, but for whatever reason, they may not be visiting that dental clinic that's in their area. You know, so that's one thing I would like to address. Also, a critical shortage of qualified dentists continue to be the most significant barrier to access. So that was already true before the pandemic. After the pandemic, there has been a labor shortage across every profession in the dental team. So there's a shortage of dentists, there's a shortage of hygienists, assistants, even front office personnel, and even dental lab techs, the people who make your dentures, you know, or fabricate a crown. There's even a shortage there as well. So without a foreseeable increase in the supply of dentists working or willing to work for the underserved, the AIAN communities must continue to rely on alternative work model and alternative workforce model utilizing EFTAs. So basically, it just allows the dental assistant, it increases their scope of practice. So with that increase, that means that they can do things without necessarily the dentist they'll have to be in the building, but not necessarily over their shoulder. So it'll allow the dentist to actually do other things as well. So EFTAs have the potential to greatly increase productivity of dental clinics, improving access and lowering costs. Next slide. So how can we increase our giver numbers, which are already good in the Nashville areas, and how can we increase access to care? One of those things is a teledentistry card. So this is actually, USET has purchased a teledentistry card, is being tested and gonna be shipped hopefully next week. We'll see. But what you'll see on, would this still be considered the left side for the people watching virtually?
Yes.
Okay, so for you virtual people, you up there. On your left side, this is an actual dental cart. So this has a computer set, it's for teledentistry. So it has a computer already set up with an actual dental unit. The bottom part up underneath the computer, this is the dental unit. What you see on the right hand is an actual portable dental cart. So, or a dental unit by itself without the teledentistry. So what we can use that teledentistry for is to go into community centers or schools. We can go to nursing homes and then enter that data. As soon as we enter the patient's electronic dental record information, it's put into that computer. And then so all of that is done, and then we can also work from that same cart. What I don't have pictured is the other equipment, like a dental chair for the patient. We have to have a dental stool for the clinician. The computer's already going to be there, but we also have sterilizing equipment to clean our instruments. So that other stuff will be there as well, but this is primarily what we'll be using to actually provide treatment. Next slide. So what I talked about earlier is with those x-rays, when you place sealants, you really want to have an x-ray because you want to see if there's decay or not. There's some debate, I'm not going to go into it, but if there are signs of decay, there's some evidence and research to say do not fill that tooth, because what you're doing is trapping that bacteria, and then it'll blow the tooth up and cause more problems. But then there's other research and literature that says that maybe you can seal that decay, or if you don't seal it, what you can do is just drill a little bit out of it. It won't even take any anesthesia because you're not going to go to the nerve of the tooth, or what we call the dentin, which is up underneath the enamel, which is the white part of the tooth, the strongest part of the tooth. So there's some debate on that, and I would let those clinicians come to those conclusions, but we're just here to provide the equipment that is necessary to increase these GPRA numbers and to increase access care to our tribal citizens. Okay, so you have the x-ray equipment. So on the left side, you'll see an actual portable unit. It looks kind of old school. We have something a little bit different though, but it's just an example of an portable x-ray equipment. And then what you see on the right is a sensor. That is what is placed in the patient's mouth, and then you take that X-ray, and then it goes up and uploads on a computer. So the dentist or the hygienist, whoever's working on that patient, they'll be able to look at those X-rays immediately. You take the X-ray, and then it pops up on the screen, and then you can show the patient this. And if the patient is a pediatric or a child patient, you can show the parent so that you can explain, what's going on and tell them how it can be treated, and then how we can maintain it after it's been treated. Next slide. And the curtains open, and thank you. Thank you all, I appreciate it. So, next slide, final slide, is my information. I am, once again, Leon Roberts, the Dental Support Center Director. My email address is lroberts@usetinc.org. Cell phone 615-403-2019. Feel free to contact me if you have any questions. Also, if you know of anybody that could benefit from the services of USET's Dental Support Center, feel free to contact me and I will help out as much as possible. Thank you all, I appreciate it. And are there any questions either live or virtually? Oh, I do have a question for the virtual people. So, yeah, let's see, if you know how many times you should get your teeth cleaned a year, if you can answer that in the chat, then you too can receive maybe not one, like we had our in-person, but you said, well, send you two! You get two toothbrushes, maybe, for being there virtually. We appreciate you. So if anybody can answer how many times you should have your teeth cleaned a year, I will tell you the answer is more than.
Oh, okay.
The answer is more than one.
There's a delay, so.
So if anybody can answer that, then you will get two, not one, but two. Two electric toothbrushes. Also, you know what, we also throw us on this too. We have some dental kits. We got some toothbrushes here with some toothpaste and some floss. So along with those electric brushes, you get these dental kits too. You get this too. So
Alright, we got someone.
we do got someone.
You said two.
That is correct. Who said that?
Mary Harrison.
Mary Harrison, great job. Please send your mailing address to in the chat.
It'll be in the attendee.
It'll be in the attendee sheet?
Yeah.
Okay, so we got you, Mary. The main thing I want you to understand is we got you. So, are there any questions virtually or in the room regarding GPRA, dentistry, portable equipment, anything? How's the weather? I don't know. Any questions that you have? If not, we're still in pretty good time.
Online, we say, love your energy.
Oh, well, thank you, online people. I love my online support. Thank you. So, with that being all, I want to thank you for attending this session. And please, like I said, I still have my last slide with my contact information. If you need anything, if you have any questions even, feel free to reach out, or if you know of anybody that may need the support of the USET Dental Support Center, please contact me. Thank you. You all enjoy the rest of your day and the rest of this session. And we have one more best practices tomorrow. Please join us, and thank you.
I just want to say that when I was growing up on our reservation, we didn't have access to dental. We didn't have access to dental. And a lot of us, like myself, we didn't have dental stuff. So that's one reason why we lost most of our teeth and had the heartaches of toothache. And missing school, even we went to school, and all this kind of stuff. And so now as I look back at my years, and I fully believe, and I take all, and I was fixing to ask you the question,
Uh-huh.
how old do you have to be to go to have, dental, your first? And, cause I have soon be a 2-year-old
Okay.
grandbaby. And, I haven't asked our dentist yet about it, because he can't come to the reservation. But I was fixing to ask him, when does he need to start going to the dentist?
So it would be by the age of 1 or whenever their teeth first erupt. So, and it varies in every child, but generally the teeth are gonna erupt around like between 6 to 9 months.
He's
So-
got a mouthful.
Yeah, so whichever comes first, that's when you want them to go. So at least by the age of 1, and really, it's not, like I said earlier, it's all about prevention to make sure something's going wrong. But when it comes to the kiddos, for the most part, it's to get them comfortable with going to the dentist. Because I will share with you that I have some dental trauma, dental phobia myself, even though I'm a hygienist. And so it's really important to get the kids comfortable with going early on, because then they won't have any issues. Sometimes, and we try to discourage this, but other kids, or even sometimes parents, they may threaten their child, well, if you do this, then we'll take you to the dentist or something like that. You don't want to make it look like a scary place. So we want them to come early so they can enjoy, have a good time. We might not even really do too much to their teeth. Just have them sit in the chair, play with the little mirror, give them some suction and they call it Mr. Thirsty is the suction, call it that. And then you have, you'll spray some air and stuff just to get them familiar. But by the age of 1, you want to get them to the dentist, And it's what you said earlier about, when you didn't go, my parents told me that the only time growing up that they went to the dentist was when they had to have a tooth pulled. And like as a hygienist, I'm all about prevention. We want you to keep the teeth that you can keep. Unfortunately, sometimes patients may neglect, and sometimes, you just don't know what you don't know. I didn't know there was a certain way to brush your teeth until I went to school for it, and then that's why I try to give that information out, so that they have the information. But yeah, if you can just go to the dentist regularly, it'll prevent a lot of things. But unfortunately, my parents and a lot of, so I'm African American, if you can't tell. And so my parents and a lot of people in their community didn't go to the dentist unless they had to have a tooth pulled. And so my dad would tell me now he has a mouthful of dentures, and he said that he wished that he would have known, and that's one of the things that sticks with me to try to tell people, because if you don't know, you don't know. And then sometimes you don't know, and it gets to a point to where we can't save your teeth. I want to save them, but there gets to a point to where you might not be able to. So go to the dentist, that'll prevent all that, so thank you for your question. I appreciate that. Anything else? Anyone else? Well, thank you all. Appreciate you. And then we'll get these supplies to Mary. Whew, Lord. Oh, I got something to do next. Okay. Well, you get the Marty and Amanda too. I have some stuff here. Oh, Lord. All right.
That was great.
Thanks.